clinic, you see that the majority, close to all, are single target or single gene therapies. Now the good news is that this does get us to cures for things like rare genetic diseases, but these have really small patient populations. So the not so great news in all this is that despite cell and gene therapy being the fastest growing part of the industry, complex multi-gene diseases are not being worked on and simply cannot be addressed by single target, single gene therapies. An example, all too familiar, billions of dollars in Alzheimer's research, decades have gone into it, 8 approved treatments, the best of which only delays symptoms barely at a really, really high cost. So where are the complex therapies? Why do we not have them at this point? And the answer is that there simply aren't any accessible multi-gene construction tools available for researchers to start building and testing multiple things at a time in the lab. And at OspreyBio, we take that very seriously. So we've developed the clone card, and you'll actually see some at our table. This is the first accessible multi-gene construction tool available for the broad research market. These 8-gene cards allow researchers to effectively swap genes in and out of a larger DNA vector, creating a multi-gene that allows you to test multiple things at once. I know it's really novel, but many things at once instead of one at a time. Faster R&D, cheaper R&D, but most importantly, this does not require expertise. Anybody can really do it in the lab. This really opens it up to the entire industry. Next slide. So again, an example with Alzheimer's. Here's just a potential toolbox. You got 3 different cards, 24 genes, thousands of new combinations to do multiple things at once, upregulate, downregulate genes simultaneously, new modes of delivery. I mean, you name it. This is the future of biotech. It's the only way the industry moves forward and cures complex diseases. Competitively, we do stand alone. We are in the biotool space. Everything we have is priced competitively. Each of our genes are very cheap comparatively. Every gene also has that native multi-gene building system within it, so it's very easy to use, very easy to cut and paste. Again, does not require expertise to build. We're going after the $5 billion gene and cell therapy discovery biotools market. All of our customers are in R&D, so whether it's academia, government, or the private sector. Our revenues, we anticipate breaking even around year 3 with positive EBITDA, driven by different revenue streams, product sales, recurring sales, and licensing for commercial, licensing our genes for commercial use. And biotools, I just included this slide because it's really important to see that biotools is actually a very dynamic portion of the industry. A lot of acquisitions, a lot of movement, a lot of IP sharing or licensing. And here are just some basic examples of big money going around in biotools. This is not even the therapy space. This is what drives therapy development. We're asking for a $1 million seed round for convertible note, mainly to expand our product line. It only costs us $6,000 to make a new card forever. And we can start tailoring those to different diseases. Really to also, we're looking to execute an aggressive sales and marketing growth plan and also develop our partnerships that we have. Notably, we have catalytic data science, which is, I'm going to preemptively say the AI thing here, which is that AI is only as good as your data. There is no data available for multigenic therapies. Don't let anybody tell you otherwise. We will be creating probably the first database that will take advantage of that with Catalytic. Management team, we have deep industry experience. Dr. Thomas Reed over here, my CSO. He is the brains behind the Bird of Prey system. And we also have our board members who are just biotools geniuses. We all have great stats. We've done a lot of things in the industry. We know what we're doing. We know what the industry needs. Thank you very much. Looking forward to speaking with you all.